Introducing Ken Gordon from the Area Agency of Aging, will be presenting. I will follow his presentation with a slideshow about how to register for Global Classroom, which is where you'll be able to complete the DNR COLST educational module. I've saved some time at the end for any questions that any of us might have. Bill's going to be recording our presentation today, and it will be posted on our website for future reference. So Ken Gordon has served as the Executive Director of the Area Agency on Aging for Northeastern Vermont for the past 9 years. The organization provides services to elders and their families in the 3-county region of Northeastern Vermont from offices in Newport and St. Johnsbury. They have a staff of 34 people and an annual budget of approximately $2.7 million. Ken's prior work includes 5 years of leading the Medical Social Work Department of Caledonia Home Health and Hospice of St. Johnsbury, and 13 years of work with the Vermont Department of Children and Families, where he provided services to abused and neglected children and their families. Ken serves on the board of several organizations, including Northeastern Vermont Regional Hospital, the National Association of Area Agencies on Aging, and is the president of Vermont Association of Area Agencies on Aging. We have invited Ken to give his presentation this morning as a reintroduction to the services the Area Agency on Aging has to offer older adults and family caregivers. Our goal is to have discharge planners utilize these available resources for their patients at discharge. All right, Ken, I'm turning it over to you.
Thanks, Jen, for that wonderful introduction, and thanks for the opportunity to address all of you today around the state. I'll try to use about 15 or 20 minutes of your time today to give you just a quick update and review of the services offered by the Area Agencies on Aging. I'm going to advance the slide now. So hopefully you're all seeing a slide that says an aging population. I think all of you are aware of this from reading in the press that we're getting older as a country, and particularly as a state. Vermont is the second oldest state in the country. And we know that in the next 20 years, the number of older adults, people age 65 plus, will grow by roughly 80% over the next 2 decades, while other parts of the population grow at a much smaller rate or even a negative rate in some cases. We also know that the number of folks 85 plus is the fastest growing subgroup among all the people who are 65 plus. So this is clearly an important age demographic for everybody to be attending to, particularly those folks working in healthcare settings. And in hospitals, in particular, there are probably a number of reasons why we want to pay attention to older adults and their family caregivers. First, we know that older adults on average have longer hospital stays. We know that providing care for them is more costly for a number of reasons, and that on average, older adults experience higher readmission rates back to hospital. So for all those reasons, particularly in a climate of healthcare reform, we really want to pay attention to older adults and making sure that they have the supports they need to meet the critical goals that have been established for them. So hopefully you're seeing a slide that says Vermont Area Agencies on Aging, and this is a quick map of Vermont and broken out into the respective areas that each of the 5 area agencies on aging serve. Just a quick note that these organizations are part of a larger national network of area agencies on aging. There are some 629 area agencies on aging around the country. They're known by different names, as you see here. Sometimes it's the Area Agency on Aging, sometimes it's the Council on Aging, or another name, but they're all united in this network that provides services for folks around the country, for individuals over the 60 and older, and their family caregivers. All 5 are nonprofit organizations here in Vermont. We have a collective budget of roughly $19 million. We're all independent nonprofits, so they're small in the realm of nonprofit world. But we think that we deliver a lot in the way of services and can be of help to you and the people that you're serving. So I'll probably spend the majority of my time today just walking through a review of each of the services that we offer. And I'll start at the top of the wheel with something called the Senior Helpline. That's a toll-free information assistance and referral service that's offered to both you and to members of the public. It's intended to be a one-stop shop where people can call and get information about the resources that are available for older adults and family caregivers in Vermont. It's connected to Vermont 211. Calls that go to Vermont 211 that have to do with older adults are referred to us in either a warm transfer or the caller is given the number to give us a call. We receive roughly 30,000 calls a year on this line, and if it's a service that we provide, we connect them to that service. If it's a service provided by another entity in the community, we make referrals to other entities in the community. The program is staffed by professional staff at each one of the AAAs who are accredited in the field of information and assistance. And as most of you know, these folks are essentially the librarians of the social service system. They're trained to catalog and be able to retrieve a ton of information about services we provide and are provided elsewhere in the community. And are also trained in eliciting from those who call what information they need, what help they need, and are trained specifically to help connect those folks with the information they need. I'll move clockwise around the wheel. The next item is nutrition, and that comes in two flavors, essentially. One is the Meals on Wheels program that most of you may be familiar with, and the other is the congregate meal program, or the senior meal sites that are scattered throughout the state. These programs offer nutrition support to older adults and family caregivers. Over in Vermont, each year over 1 billion meals are served between the two programs, and we don't charge for any of these services. People are offered the opportunity to make a donation, a private donation, but none of the services we offer are done at a fee, and we don't do any means testing for the services, at least that we offer. The availability of Meals on Wheels and senior nutrition programs varies considerably around the state, so it would be important to be in touch with your area agency on aging to find out if meals are available in that particular area of your region. Not all meal programs serve 5 days a week. Some serve 2 meals a day, breakfast and lunch, so it just varies considerably. A lot of pressure on these programs. More and more people are staying at home, and so these are largely volunteer entities that provide the service in their communities. And maybe an important message for you all to know is just because you think there isn't home-delivered meals provided in a particular area that's in your catchment area, please call and let us know that there's demand, because we want to know where the demand is and to be able to provide services to folks where we may not have senior meals available. And oftentimes there's something we can do to make sure that to get meals out to somebody where, on the face of it, it doesn't appear that meals are being offered. We also offer transportation services in partnership with the public transportation providers throughout the area and throughout the state. Generally, we provide transportation for those folks who don't have Medicaid paid for transportation, and provide transportation for essential services. That generally means medical and nutrition. So if you haven't made use of the transportation services that are available to older adults in your community, please contact your area agency on aging. In the Northeast Kingdom, we provide over $250,000 a year of transportation for older adults who don't have other means of getting to where they need to get. And there are a variety of sort of services, transportation services that can be provided. Some are provided by volunteers, some are using fixed route transportation, some are using flexible fixed route transportation. So it again varies significantly across the state, but worthwhile looking into if you aren't familiar already with how public transportation works in your area. Much of our work is related to public benefits outreach, and this is the Fuel Assistance Program, the 3 Squares Vermont program, and other public benefits. And our case management staff does a lot of work in helping people apply for these benefits and make use of the benefits. As you know, the Department of Children and Families, the Economic Services Division, has been really stretched. And so they've asked their community partners to do more work than ever before, and so that's affected our work. But we do a tremendous amount of assistance to the public in making use of these benefits and are here and available to help your patients make use of these programs. Along those lines, we also do a lot of work in terms of health benefits counseling, and we have something called the SHIP program, which is a state health insurance counseling program, and it does a lot of work around Medicare Part B and assisting Medicare beneficiaries with all the various issues that come up in healthcare health benefits counseling. We also provide legal services for older adults at no charge through a partnership with Vermont Legal Aid. And there are many sort of interesting legal challenges that older adults face in later life, including the garden variety of things that we all face regardless of age, tenant-landlord relationships, credit issues, and so forth. But we have a contract with Legal Aid that's around $300,000 worth of legal services that's provided to older adults each year, and we'd like to help your clients make access to that service. Much of what our work, much of how we do our work is through volunteers. At the agency I'm responsible for, we have some 300 volunteers and about 30 staff. So you can see for every one staff, there's 9 or 10 individuals who are backing us up as volunteers. And those folks do a variety of things. They deliver meals. They work at area meal sites. They serve as AmeriCorps neighbor-to-neighbor members who do direct service in the homes of clients. They provide transportation for individuals and in many other facets of our work. And so we have a group of people throughout the state that do background checks on volunteers and who help with volunteers and retain them as well. We also contract with the local mental health agencies in something called the Elder Care Clinician Program to address the mental health needs of older adults. As you know, that's often an area that is not well resourced and oftentimes contributes to premature hospitalizations or premature use of long-term care, institutional care. And so if you don't know about the Elder Care Clinician Program in your region, you may want to talk with your contact at the Area Agency on Aging and inquire about that service. Much of our work these days is focused on caregivers and supporting family caregivers. And if there's anything that I'd ask you to take home from this talk would be to think about supporting the family caregivers that you encounter in your work. As you know, much of the follow-up that people need upon discharge from the hospital depends upon family caregivers. And these folks are sometimes at extraordinary health risk themselves, and we rely increasingly on them being able to help our patients follow through, and so we want to make sure they get the support that they need too. So we offer a variety of services, including grants, caregiver training, support groups, and other forms of support to make sure that the family caregivers who are out there are getting the help they need to fill that role. Two last areas that we provide some services in. One is what we call healthy aging. This is wellness programming and injury prevention programming. Each AAA offers a variety of wellness classes, including Tai Chi, a matter of balance fall prevention class, strength training programs, healthy eating programs. All of them are evidence-based programs, and you certainly can contact your AAA to find out more about the services being offered in your area. And lastly is our case management program. That's the cadre of some 75 case managers who are out in the field across the state supporting older adults and family caregivers, doing home visits, helping people make use of all the long-term care supports and services that are out there in the community, and providing in-home support as well to make sure people can live independently at home. So that's a very, very brief overview of the services that we offer. In the remaining time, I'm going to try to advance the slide here. Let's see if we can. There we go. And to give you a little sense of how we might be able to help moving forward. There's three areas where I think we can help, and we're all very mindful of accountable care and the goals of healthcare reform. And so there are three areas where you might want to consider referrals to the Area Agency on Aging, or talking with us in more detail about how we might be able to support your work. First is in hospital avoidance. As we know, the name of the game is changing. It's no longer about, it will no longer be about hospital beds and filling them in order for hospitals to be paid. It will be more about helping people avoid unnecessary use of hospital beds. And so all the things that I just got through talking about can help people stay healthy and remain functional in their lives. And so many of those supports we'd love to partner with you on to make available to everybody that we serve. The second area has to do with care transitions. A lot of focus these days on care transitions, and that means a lot of different things. It means transitions back home. It means transitions to nursing homes or other care settings. It means transitions from EDs back home. And so we're involved in a lot of that work and can be very helpful with some of the services we provide to ease that transition, to make for successful transitions. And there are models throughout the country of where area agencies on aging, hospitals, and health systems are working together to avoid unnecessary rehospitalizations. And then lastly, in the realm of long-term care planning, we do something called options counseling, which is an opportunity to help people understand and plan for the options that they have available as they need long-term care supports and services. And so are expert in that and can help you, your staff, and clients and families understand the options that are available to them. We're working on a discharge planning checklist, and you see a draft copy of it, which has undergone some revisions from when I shared this with Patrice and April and Jen 2 weeks ago. And I will send a draft out to Patrice and ask her to circulate it to the rest of you for comments because we are in the final stages of preparing this and want to make it available to you and to other folks working in acute and primary care settings to use as a tool to help for clients and to use as a guide for yourself in discharge planning for the older adults that you're encountering. So I believe Jen said that she would hold for questions at the end of her presentation as well, so maybe we should defer until then. And I just want to say thanks. We're out here ready to help in whatever way we can, and don't be bashful about calling the senior helpline or your respective AAAs, and we'd be glad to partner with you moving forward. So thanks very much.
All right, thanks, Ken. We were just talking here about how great your pictures are.
Oh, great. Thanks.
All right. So I'm going to go into the introduction for registering and getting started on the medical decision making, which is the DNR COLST education module. I did send a copy of these slides to everybody. If there's somebody there that didn't get them, email me and I will send you a copy. So on the home page of the VPQHC website, which is www.vpqhc.org, is where you're going to enter the Global Classroom. It's right on our home page. You just hit the register button. Now, this section, if you've already previously registered for Global Classroom, then you already have a username and password which you can put in. If this will be your first time registering, you need to click on the Please Register button here. It will bring you up to the Register tab. You need to put your first name, your last name, and your email address that you want to get the confirmation email sent to, and that you agree to the terms and conditions, and then hit the Register button. You'll get a little message that says you have successfully registered. You need to check your email at this point. You're going to get an email that is from us, and you're going to click on the link. That will bring you to your username and password page. You get to choose a new username if you don't like the one that's already there, and then your password, and then confirm your password and hit submit. All right. You need to click on the dashboard area, which is right here, and then this is your Global Classroom dashboard. You're going to hit on the course button, and it's going to bring you up to the Medical Decision Making course, which is the DNR COLST course. And at that point, you can begin taking the course. There's 3 modules. There's also quizzes, and it's very self-explanatory after that point. So at this point, that is my presentation, and so we will open it up for any questions or comments that anybody might have. Does anybody have any questions?
Hi, this is Julie at Porter Hospital.
Hi, how are you?
Good, how are you?
Good.
Back in the beginning, it stated that this was going to be recorded and posted on the website. Which website is that? You'd find that on?
The www.vpqhc.org website. That's our home website.
Oh, okay.
And it will be right on the first page under the news section.
Okay, great. Thank you.
You're welcome.
This is Ken Gordon. I just wanted to plant a bug in people's ears. We had the privilege of attending the discharge planning meetings at the Northeastern Vermont Regional Hospital. We've done so for many years now, and it's been really helpful, I think, for both the discharge planners there as well as our staff. And I want to encourage you to think about that notion. Obviously, there's some challenges in terms of confidentiality and other logistics. And I know you guys are under extraordinary pressure as you do your work each day, but it has been helpful, and it may become increasingly relevant as we move into this new era of healthcare reform.
Hi, Ken. This is April. I just want to say I totally agree with you on that, and that's been my experience as well. And I have 2 questions for you. You had a comment that we are the 2nd oldest state in the country, and I wondered where that statistic came from.
It comes from the census data, and it's the mean age, which is a little bit misleading in that it's it takes everybody's ages and averages them on some level. And so Maine is first, Vermont is second, and it has to do somewhat with the outmigration of younger people and the staying put of older people. There's certainly a lot more older people in Florida and in a couple of the other states in the country. Vermont is relatively small, but the percentage of older adults is higher here than in most states, and there's no indication that that's going to change over time. And so I think, the next 20 years we're looking at a really profound cultural shift in our society that we're going to have far more older adults than younger people. It has a tremendous number of implications in terms of family caregiving, in terms of labor force, and in terms of how we view older adults and their role in our society. So it's an exciting time to be thinking about this too, but a challenging time as well for those of you in the healthcare field where you see a lot more older adults who, in some ways are healthier, in some ways are not, and who are being asked to manage a lot more technology at home than people have been asked to previously.
And the other quick one I had is, you said you received 30,000 calls on the senior helpline a year here in Vermont, and I was wondering if you knew what the top percentage of, or the top 3 things that people are calling in about.
Yeah, we do monitor that carefully, and it varies according to the time of year. Fuel assistance sometimes is a really big issue. Medicare Part D enrollment is a big issue starting on, I believe, October 7th this year, moving to December 15th. Clearly, if you have people that you're working with who need help there, some of you may have seen the headlines from yesterday, but It looks like some people will, everyone really needs to take a look at their Medicare Part D plan every year to make sure that their medication is covered and they're getting the best deal that they can. We get a lot of calls about in-home support. We certainly get a lot of calls about senior nutrition. And health benefit counseling is the third. So it's those three basically that are the biggies.
Thank you.
Any other questions? All right. Well, thank you very much for everybody for joining us. And again, let me know if you have any questions. My email and telephone number are on the slides.
Thanks so much.
Thank you.
Thank you.